Si vis pacem para bellum. If you want peace, prepare for war. Publius Flavius Vigilius Renatus, 4th century AD. COVID-19, was a crazy, crazy time, and we want to make sure mistakes don't happen again. We want to be prepared for the next time. Marian Moskowitz, Chairwoman, Chester County Commissioners. Hi, I'm Frank Spidell, a retired emergency physician and recovering hospital administrator, and welcome to The Doctor Is In. The program is not to practice medicine or to provide medical advice. With the help of our guests, we hope to provoke respectfully informed discussions of health care to the benefit of our community. Planning. Our plans range from picnics to car washes, also thermonuclear exchanges and pandemics. For tens of millennia, from the time we started our first fire, from the first time we placed a stone upon a stone, we learned thinking ahead, planning, for most of the time leads to better results. For some things we plan for, such as the tie I wear to the show's taping, the consequences are predictably trivial. Some events are rare and without significant consequence. Planning is optional, but some events, disasters, have profound consequences. They overwhelm the resources readily available in a location at a given time. They may be frequent and location-driven, like tornadoes, or rare and explosive, such as a novel virus pandemic. To the extent we can mitigate or manage the outcome, planning for these is not just an option, but a duty. Now, I have watched over the decades more resources dedicated to responding to disasters, and planning is planted thick through government at all levels and permeates a menagerie of organizations. Look at the org chart for Health and Human Service. Health and Human Services has an Assistant Secretary for Planning and Evaluation, ASPE, and an Assistant Secretary for Preparedness and Response, ASPR. Beyond Health and Human Services' commitment to preparedness, the CDC adds Emergency Preparedness and Response, and the NIH adds in a Division of Emergency Management. So a reasonable person would conclude that our society was prepared for the COVID-19 pandemic. Now, I may be a minority, but for all those resources committed at all levels, I think we face-planted, and I fear we'll do so again. I am honored to have as my guest today Professor David Nitsch. Professor Nitsch has committed to creating better response to disasters. He is the driving force for creating a master's level program at Thomas Jefferson University to understand and teach optimal response to adverse events that overwhelm the local resources. Professor Nitsch, welcome to The Doctor Is In. What did I get wrong?
Well, thank you for having me. I appreciate being here. I don't think you got anything wrong. I think there's a lot of discussion to be had on this topic. So I appreciate you having me today.
What got you interested in disaster and emergency management?
Great question. So I had I would imagine not a dissimilar path to those folks in emergency management. I started out very young in the volunteer service and on the emergency services side of things, and that just seemed to progress. I was pretty fortunate to have some mentors in my life that took that youthful enthusiasm and channeled it into better things. And that just led me to some interesting things. I spent some time on one of the federal urban search and rescue task forces.
Wow.
Yeah. So, and that led me to spend some time in the Middle East during the wars. And then when I came home, finished an education. It's a natural progression, just to lead to emergency management. I realized probably somewhere in my 30s that it wasn't as fun to stand out in the cold and the snow and the rain as it was in my 20s. So, so again, natural progression, and it's a fascinating topic, to me to prepare for and help to mitigate disasters of any kind.
May I offer that you have a different background than many people who make comments. You were there firsthand. You were hands-on. You touched, you saw, and you did. And you felt the cold, and you felt the craziness of an uncontrolled environment with uncertain information. It's a great way to start.
It helped, absolutely.
Since starting the program, what surprised you about it?
About the master's program?
Yes.
Surprise. I don't. Nothing. Surprise. I don't think is what I would use as a term. I'll be a little. Let's take a step back from that. I'm pretty grateful to be in this program. And I see it as a natural progression. In my mind, it's our responsibility to develop the next generation, and not just necessarily practitioners. I think, especially in a master's program, it's not. To develop a level of practitioner is not really our responsibility. I shift that to developing next generation of leaders in the emergency management field. So I think that's what really differs in my perspective with the program is developing that next generation.
It's a natural segue. Who's the program targeted for?
The program's targeted for anybody with an interest in emergency management. So we look at that, and we've had previous students literally from all over the world. We have a hybrid program at Thomas Jefferson. Currently, we're also standing up a new executive master's program. So, and that overlays the topic of who attends. So we've had students anywhere from business through the typical emergency management realm, certainly healthcare. And we've even had military folks as well, both in the United States and again abroad. We've had students come in.
That's incredible. How long has the program been up and running?
Boy, I'm very new to the program. So I started it just about a year ago. The program has been well over a decade, and it started out as really just a brainchild of a few folks that looked at a gap and said, this is where we need to address this, and that's really how the program started.
In planning for disaster, planning to optimize the response to disasters, is there a role for an after-action report? Oh,
it's essential. Absolutely. Yeah. So for the audience, an after-action report is just that. You take what has occurred throughout the disaster. There's lots of documentation that should occur during any disaster, especially a protracted disaster. And how you get to that end is a little nuanced. There's not necessarily a rule book that says this is how you're mandated to conduct an after action review. But the short answer is you gather all this information and you analyze it. What worked well, what didn't work well, and then more importantly than that, we look at the whys and how do we improve upon our actions for the next time.
Is there any time frame as to when that after-action report should be done?
Certainly sooner rather than later. I think is the standard. However, again, it's nuanced. It's a flood that lasts for 2 days is going to have a different level, manner, degree of after-action review than a protracted event. If we look at
pandemic,
we look at a pandemic. Then yeah, that's certainly going to take much longer to. Think about the various degrees that you need to look at and what context you're looking at. Is it a hospital after action review? Is it emergency management after action review? Is it a public health after action review? So to gather all that information from all those various sectors and to kind of collect it all together and put out one after action review, that's. I won't say an impossibility, but that is a ton of work to try and pull together from different facets and different fields. So.
I would think that an after-action, in the military, we used to call them hot washes. Mm-hmm. You wash the car when it was hot. Mm-hmm. And that there was a great virtue to getting people together right afterwards and get the first edition, knowing that that's never going to be definitive. That I think a healthy after-action review is an ongoing process.
Absolutely.
That as time goes by, what we thought immediately after the event was a good idea, or was a conclusion, or something we focused on, in retrospect, maybe a year later, we would see it as we should have focused more. We should have asked more questions about Alpha, Bravo, Charlie, as opposed to what we thought at that time. Who should do it?
Great question. There should be somebody from every facet that's involved. Similar to the military model, that you talked about. I know from my time overseas, we would AAR regularly, right? Way after every mission, and it didn't have to be a complex, written thing. It was what went wrong, what do we see differently, and again, the nuance of that is what's the complexity of the situation. So when do you do it? As soon as possible, but and who should do it? They should be specifically trained for that. I mean, it's a skill set. To say that, you're the low man on the totem pole, that's work that I don't want to do, so we're going to task you with doing the after action review and leading that, I don't think that's correct. As you start to grow in complexity, leadership can then assign people that are properly trained and equipped to be able to do that. And that's much more in the traditional emergency management sphere, where you'll have certain sections of the response or the management structure that's going to be tasked with doing that review.
A personal, by the way, observation. I've been fortunate, thanks to my mom and dad, to have some degrees from, I think, what people consider very impressive places. I learned more from the Marines and the Navy about after actions and reviewing what had to be done than I did from one of the finest business schools in the world. One of the things that I learned is if you have people that were involved in the process looking at it only those folks, they get tunnel vision. That we are all benefited when we get outsiders who are kind of not involved to come in and look at it. I used to have 64 spaces on a carrier. I was responsible for the material conditions of them. And I used to get another department head to come in and walk through my spaces and look at it with his set of eyes as opposed to my eyes that saw it all the time. And I think that's one of the things that you have an opportunity in your program to get people to maybe see the virtue of having outsiders look at what we've done. I think one of the, I have a few concepts from disaster response planning, one of which is that there's a danger of a silo effect. You got a big smile. Tell me about that, Professor.
So in a previous life, I worked in an emergency management agency for the state, and the silo effect, we call those cylinders of excellence as an aside.
Cylinders of excellence?
Cylinders of excellence.
Oh, I love it.
So
I'm going to steal that. That's
please
great.
do. Yeah, please do. The siloing effect, that is something that we continue to try and break down. And I'm not suggesting that is, it's a malicious intent behind it. But I think it's just a natural occurrence, right? The people we work with every day, the people we see every day, they're familiar with what our taskings are. So perhaps it's a natural occurrence, and it's something we collectively, the emergency management field, they have to strive to break down. We say, jokingly, the cylinders of excellence is because of the way that one department does things, and you can broaden this out, whether it's a local government, state government, federal government, or township to township, or university to university. They're going to do things a little differently.
The most recent event, the pandemic, which was devastating. One of the things that struck me early on was to see pronouncements being made by people who were much smarter than me, asserting things that were not consistent with what they had said or what their organization had said 12 years earlier, or consistent with what another department was saying, where you had literally departments pointing fingers at each other. I found that especially troubling. And that's one of the reasons I asked about the silo effect. Sure. People were talking about why there was no transmission of COVID on airline flights. And one of the conclusions that was made early on, well, they had a few people they thought had it. So they physically separated them. The air exchanges in a commercial aircraft are 11 to 17 exchanges per hour. In hospitals, if we're going to aerosolize infectious material, all we require is 3 air exchanges per hour. Some people in CDC knew about that standard for aerosolizing infectious material, but they weren't talking to people that were writing reports about the lack of transmission with separation, physical separation on airliners. You guys need to talk to each other. I'm getting off topic here.
It's easy to do.
Yeah, I love that silos of excellence.
Cylinders of excellence.
Cylinders of excellence. Why do you think that there's been a sparseness of after actions on the pandemic?
It's a great question. I don't necessarily have a crystal ball to be able to tell that. But certainly, as we talked about before, I mean, I think one of the foundational challenges with COVID is why we did have pandemic plans in place. Worldwide, nobody saw what we looked at before. The previous outbreaks of pandemics, whether it was SARS or avian influenza or something, they were effectively localized events, right? And the way we had trained and planned on that, and again, collectively emergency management, public health, was these localized events. So the very typical, model, if you will, was there's this need in this localized area. We're able to pool resources to assist in that area. Nobody saw COVID coming. Certainly we had, and what I mean by that is the breadth and depth of it. Certainly we had ideas of pandemic plans. But again, that localized concept, and now we take that localized concept, and now there's no way to muster additional resources because everybody is asking for the exact same things, literally all over the world.
You mentioned preparing for the pandemic. In one of the earliest shows I did at this station, preparing for it, this was like in April of 2020 or March of 2020. I think it's actually March of 2020. I have one of my slides because what I did was I went to the Pennsylvania Department of Health, did a Google search for a pandemic, and there is one document. I've got screenshots of this. The document is dated 2005. It says influenza pandemic plan, 2005. And when you open it up, every page is marked draft. Do you think that had been regularly reviewed by the Pennsylvania Department of Health?
I could speculate. I think it's also important, there is a degree of operational security, if you will, to putting the most up-to-date plans out there for everybody to see. How do you balance transparency versus some degree of security? If we put our playbook out for everybody to see, from an exploitative lens, is it easy to exploit the weaknesses in that? So
you think a terrorist might change his approach to a biologic agent based on what we had in our...
I think it's a possibility. I think, if we were you apply that to any other context, and there's certainly, there's a reason why we have, that pre-Normandy had a media blackout, because they didn't want those plans being sent around. Now, it's a very far-reaching concept, but I think there is some underlying truth to that. Do you necessarily want to put the most up-to-date version of things available to the public? And that's a policy question. Right?
Well, it's a policy question that I disagree with profoundly.
Okay.
I think that when you keep the secret formula for Coke in your back pocket, where Coke is a pandemic, I think that needs to be out there for the public, for everybody to see and interact with. The plans for Normandy were not held by just two people. No. It was on a need-to-know basis, and the need-to-know was time relative. And I just didn't sense any of that. What I suggest is more the lethargy of bureaucracy, where no one is saying, when did you review the plan? Have you signed off on the plan? I know that beginning in the 80s in the Commonwealth of Pennsylvania, to get funding for EMS from the state, you had to have a disaster response plan that was reviewed annually. And there had to be a sheet there where you signed off that I reviewed it on this date and these were the changes, or this date there was no changes, and you had to be able to know who, what was doing. Now, the disaster response plan might have been available to some terrorist who wanted to harm us. But at the same time, I think that that's a trade-off because we want to know that we're reviewing this and we're doing this. Do you see any movement to have disaster response plans reviewed at any time by anybody?
I think they're reviewed often enough. And the other thing we have to remember is, was it Eisenhower that said, planning is everything? A plan is nothing, planning is everything. And the idea of having, just this...
It's a process.
Yeah, it's a process, and it's a continuous process. And there's an argument to say the moment you take draft off that document, the next day it's somewhat outdated.
That's true.
So I would much rather lean into the idea of making good decision makers, leaning much more heavily on the training aspect of what plans are, what are responsibilities during an event, rather than trying to flip open to page 6 and see what's on subparagraph 3 of that page.
Could not agree with you more. Somebody said one time, I hope FEMA's not listening, somebody said one time that a good disaster response plan, you ought to be able to write down the elements on one side of a page. And its qualities, you ought to be able to write down on the other side of the page. If somebody held that standard, what should a good disaster response plan have? What do you think the elements of it should be?
That's a great question. There is, and I look personally. I lean heavily towards the idea of preparedness, right, and not necessarily the idea of a written plan. Again, I'll circle back to the training and retraining of those aspects. I lean heavily into the all hazards mantra of planning.
Absolutely.
Instead of having, and this it's an evolution in terms, and we have to remember in terms of a field, emergency management is pretty new. It's still pretty new. We look at, FEMA wasn't even in existence until a couple of decades ago. So, and then it evolved from the civil defense era and all that, and now it's now we're shaped into a real field of a real profession, if you will. So to get back to the idea of what are the good elements, it's difficult to say.
Okay, so you said planning, preparation. So planning, you want to look at what are your threats. You want to survey what you have right now. It's a different set of plans if I'm sitting in Westchester, Pennsylvania, than if I'm sitting in Tulsa, Oklahoma.
100%.
The threats are different. So look at and the other thing you might want to do when you're planning is identify resources that you have.
Exactly, and that's part of the planning process. The idea of a THIRA, or THIRA, however you want to say that. It's a threat hazard identification and risk assessment. That is a mandate that.
Could you say that again slower?
Slower, much slower. Yeah.
Slower for the folks out there.
THIRA, threat hazard, and risk assessment. So what's the I stand for? Identification there. So let me say it all together again. So it is a threat hazard identification risk assessment.
So that's something like a tornado here in, oh boy, we're running out of time real quick.
Sorry.
That's my fault. That's what, so something like the hazard of a tornado is happens here in Westchester, in Chester County. But it's not quite the same as it is in Tulsa. So I get that. Right.
We take a look and that's what we do. We evaluate what are our greatest threats, and then how do we address those threats.
Great. The other thing I think you're going to want to talk about communication. How do we communicate? We got to drill on that. I think that's something we consider in our plan. How is communication done? But if we're going to communicate, command and control. Who's command and control? And that can be a real furball. I think you probably know that better than me.
Well, and again, it is as the complexity of an event grows, so too do the issues with it. And from I'm sure your time in the military, one of the first things that is always a challenge is the communications. Now, whether that is something is I'm on the wrong frequency, or even communicating through what are the orders that are coming down from above that never get communicated down because for whatever reason. So that contextually, you can put that anywhere you want. And is that something that you address in your THIRA? And again, that is in Pennsylvania, that's a local level decision that needs to be addressed. And
who's an incident site commander in Pennsylvania by law?
By law, it is the local level senior official.
It's not the fire chief.
It's not the fire. It can be the fire chief, but it is it's your elected. I mean, and that's where that's where we tend to not think about things, and it kind of gets in that gray area of emergency management versus policy. But yeah, the local level senior official has they're the person in charge. Now, that delegation of that role is something that happens all the time.
Well, hopefully it does. Hopefully. That can be a challenge. Professor, this has been great. The time has absolutely flown by. I'm going to close with asking a last question. Some organizations deal in the presence of uncertain, ever-changing information, deal with high outcome events that are unstable with a lot of kinetic energy. Fire sites. What happens that is, stay tuned. The deck of an aircraft carrier. There are the number of emergency departments where you have a room full of sick patients and we have 5 gunshot wounds come in, and that's happened. Some organizations, what do you think the characteristics are of those organizations are that where they manage this junk all the time, this craziness?
Yeah, I think there are some people that are drawn to that craziness, right? They have, that's why we have emergency departments. That's why we have emergency nurses, emergency physicians. That's why we have emergency management, because people are drawn to that idea. I think the other similar characteristics is there's an idea, 2 schools of thought between the willow and the oak, if you will. And I want to say that's an Aesop fable, and as you can attach that to sort of the response to a disaster. You can have this great burly tree that holds and is impenetrable and everything until it's not. And then you have a willow, which kind of just flops in the breeze and it gets knocked over and it stands back up. So whichever, I know which side I lean towards, but the folks that are in the trenches every day, as you will, they're different character people. They have a very specific set of skill sets that is usually, keep behind glass until until disaster. And especially in emergency management, there's a tremendous amount of things that we do in emergency management that are not disaster related.
Professor, I can't thank you enough for taking the time, traveling to get out here and talk to us about this. For those of us who are fortunately sitting behind a desk and not trying to manage the disasters of the world, we are grateful to have people like Professor Nitsch here who are creating the next generation of leaders for this. Thank you for watching The Doctor Is In. Stay safe.